don't have to tell the client that. And for the other direction, it's usually easier to actually be on the other side of the table, so you're actually pulling it this way, and then you're pushing this way. So again, on the other side of the table to get it in that direction. Okay, for the tibialis anterior region, so it's on the lateral side of the tibia bone here, you can actually eventually plantar flex like this, so you're getting a little bit of a stretch, and this hand's going to do more of the movement. Or you can do a cross-handed stretch. I know it's a little bit awkward for this region. It's a lot easier when they're supine, but again, if you don't have a lot of time, it's just another way to approach it then. Okay, next one, more for the biceps femoris over here, and then also tensor fascia lata region. So what we're going to do is rotate like this, so you get more of the IT band region. And you can actually separate it like this, or you can just do more of a cross-handed like this region too. But if it's too uncomfortable for them in this position, you can actually get more of a half bolster. You can actually put it through their inguinal region, so it's a little bit more comfortable, so it's not pushing right down on the table with that. Some people just roll up a towel in that area too. So again, whatever they feel comfortable with for those areas. They can also, right at the glute region, you can get more of the lateral side too that way. Especially runners, they're going to run into a lot more problems, a little bit more tightness in the IT band region. So then you can bring it back then like this. And then again, any joint regions, especially like with the elbow region, you can actually push in to build up a little bit of strength with the fascia region. But again, you want your fingers quite far apart, and you're eventually going to interlock them even with the stretch. With the calf region, a lot of people have problems there. So you can actually kind of cup your fingers, and your fingertips are not going to move at all. The palm is eventually going to go around like this then for the stretch. Or again, you can use more of a cross-handed for that area. But even with the peroneus region, on the lateral side of the lower leg, just bring the leg over here a little bit, you can actually perform a little bit with this too. But as you can see, she's not as flexible, so it's not actually resting on that region. So you can actually put a pillow under there, or you can actually get over on the other side and put your knee underneath this area, just so it's a little bit more comfortable for them. And you can even kind of cup, bringing it down. With these techniques, again too, you want to make yourself as comfortable as possible. Just because if you're not, you're going to actually injure yourself by actually performing the treatment. So that's why if you need to, rest your knee up on here, but again, use your body strength to actually bring it down, so your body weight and everything else. So just don't rely on just your upper body as much of your own body as possible, so you can just kind of drop it. So you can even kind of cup it, bring it down too. Okay, next one, you can actually sit on the edge of the table. So this, again, you can, probably not with the first time client, but just ask permission whether it's okay to sit down every now and then. But you're going to just rest it on your anterior deltoid pec region. Then you're going to actually just going to bring it down eventually like this. So again, it makes a great massage technique like this too. And just gives you a little bit of break, but the client doesn't need to know those kind of things. So the next one we're going to do is actually interlock. Just lean your whole body. But with women that are the therapists, just make sure it's not pushing on the breast tissue, especially opposite sex. And eventually you're going to bring it more like this, and you're just going to kind of lean back to get more of a stretch right in the gastrocnemius, the soleus region. Okay, let's go to the foot region.